Have you had an accident? What kind of doctor do you need? For accidents and injuries, the type of doctor you see is going to be dependent upon the extent of your injuries. One of three things are going to happen after an accident. First, you're going to walk away without any injuries. You sustain mild to moderate injuries that require a visit to urgent care or a trip to your primary care doctor's office, or you suffer serious injuries that are going to require an ambulance or some sort of life flight transportation or emergency care. In any case, it's important to understand how this personal injury process works so that you know what to expect so that you can ask the right questions. If your injuries are severe and someone at the scene says you need to go to the hospital, listen to them, please. Try to remember that you are likely in shock after an accident, so it's best not to drive anywhere. Just follow the guidance of the first responders. If you experience any of these symptoms, your accident injuries really need some serious medical attention. Things like dizziness, confusion, weakness, profuse bleeding, head injury, neck or back injury, and if you've had a loss of consciousness, even if it's just brief, a broken bone or deep lacerations, in these cases, you want the emergency room. If you have a medical doctor that you commonly see, they'll be contacted and they'll be responsible for coordinating your care with other medical specialists. When your accident is not an emergency and there are mild to moderate injuries, you may not need that emergency room at all. Instead, you can go to an urgent care center or schedule an appointment with your regular doctor as quickly as possible. Even if you don't think that you have an injury, it's always best to follow up with your doctor because sometimes problems like internal bleeding and whiplash can really be silent for a few days before suddenly getting much, much worse. After an accident, your primary care doctor is your liaison into the complicated work of personal injury. Your physician is the best person for this job because really they're going to know the most about you. Then they can start sending you to different medical specialists for consultation. At the specialist's office, you're going to undergo a few studies, exams, tests. It'll give the doctor an idea of what it is that they can do to help you heal. The specialists you'll see will really be determined upon the extent and the type of your injuries, but some of the more common type of specialists include people like me, a chiropractor, orthopedic surgeon, radiologist, trauma surgeon, burn specialist, neurologist, plastic surgeon, a physical, vocational, or occupational therapist. And really, no matter the injury, you're going to want to see a chiropractor who specializes in accident injuries like whiplash, long-term neck pain, and back pain. At Slovin Chiropractic Center, we know how complicated these things get, and we want to do whatever it is to make things easiest for you. We work closely with local doctors, personal injury attorneys, and providers across multiple specialties in order to provide the most complete care for our patients. If you have questions about this process or what we can do to help you, call us. If you're ready to start working towards a treatment plan, let's get you on the schedule and give us a call. I'll see you soon.